Hello, good day, and welcome to Doc Talk. Thank you for listening. Today we are discussing brain injury and recovery from the patient's perspective. For new listeners, the purpose of this podcast is to explore and understand perspectives and, whenever possible, help one another out. I am joined by Courtney Nohilly. She is a mother of 3 and has a bachelor's in mathematics with a minor in computer science and a master's degree in statistics. She has served 12 years as the Operational Research System Analyst for the Army Evaluation Center. She is specializing in testing and analyzing air defense systems. She is currently working on her Ph.D. in data science. Hi, good to see you.
It's good to see you.
Awesome. So our listeners know that we're going to be talking about brain injuries, and today I really want to hear about your stroke.
So about 11 months ago, I had a stroke that I guess it affected my communication center. And so I woke up in the middle of the night. So it happened about 12 o'clock at night. So it happened like right at around midnight. I woke up and I had this splitting headache, just this awful headache on one side, and then yet the other side kind of felt like I was floating. It was almost like I've heard it, some other stroke survivors will say like almost like a nirvana, like you're outside of your own self. But there was also this awful pain in my head. So I woke up and I went and took some Motrin and went back to bed. Now I did feel a little dizzy at that point, but I was also woken up by a dead sleep. So I didn't really contribute that dizziness or feeling a little bit off balance to a stroke or anything serious, because I just woke up from a dead sleep. And then I just turned over and went back to sleep. I woke up about 6 o'clock in the morning to my alarm, and I felt normal when I woke up. And the first thing I usually do is I grab my phone and turn off the alarm, and I'll look to see if I have any messages from work or just the normal. And I looked at my phone and it was on the lock screen with the numbers, and the numbers didn't make any sense.
So that sounds terrifying. So you didn't make any sense to you?
No, it made no sense at all. It was weird in that, like, when I was looking at it, I was like, so I had my phone and I was like pushing it, and I was just kind of like a toddler would with a new toy that just to push buttons. And I was just pushing it. And I was like, this is weird. In like way in my brain, I knew those numbers, what those numbers were, the names of them, but I was not connecting that to the phone. And like it was just, it's like I could see my password, but I couldn't connect that to anything, what I was doing. So that was my first sign that something was very, very wrong. It was the first day of school. I was freaked out because I couldn't get to my phone. I was teleworking. I tried to get into my computer. Obviously, numbers don't make sense. I made a mess with my computer. Like the tech people at work had to completely redo something because I locked it out so bad. So I went, and my kids, I started to say something to my kids, and they looked at me like, what? And then I was able to get out, I funny. And I was trying to say, I sound funny. And they were like, you're being funny. Like, they're like, you're being funny. And then
You're not trying to be funny.
No, not at all. Not at all. And they were like, okay, I was just trying to think, and then I just pointed to their computers because we were doing, it was the first day of school virtual, and my 12-year-old, he knew what to do, and then and he was 11 at the time, and my 9-year-old, she was just looking at me like, she's like, I have to get it. She told me she has to get into WebEx. And I couldn't even say WebEx. And I was trying to explain to her that we needed her email address. And I just kept saying the thing, like and then I pointed to my 11-year-old, and he was like, you need your sign in. I don't know how I got her on. Luckily, EPIC was having an awful time. So I got her on, and still at that point, nothing in my brain said, go to the hospital, nothing. And so I said, I went and laid down. I went to take another nap. Don't do that.
So I know that once I realized when I had my traumatic brain injury, that I wasn't functioning as well either. I was really frustrated with that. Was it similar for you, or did you have different sets of emotions?
I was extremely frustrated. I was, and like, and that I was, and it was almost kind of making me angry because I was frustrated because I knew, like, I know how to be an adult. And I was just like, man, what's wrong with me? But it's still not going, I need to go to the hospital. And so I took a nap. I made my kids lunch, all of this without speaking. And then I took a shower. And then after the shower, I tried to say something to my kids, and it still was not coming out. And luckily I was able to get, my best friend's nickname is LD. And so I got that out. I got LD. And they were like, do you want us to call LD? And I just shook my head. So they called her. She lives on the complete opposite side of town. And then I managed to get the word Jody out. My kids didn't have Jody's number. Jody is a coworker and a good friend who lives 1 mile from my house. LD happened to have her number. And when my kids said, my mom's saying Jody, she said, okay, I'm going to call her. She called her and told her, I think Courtney's having a stroke. Can you get over there?
So that's really interesting. So your friend recognized that you were having a stroke. Were there any other signs that you were having a stroke? Like, were you having, facial droop or having trouble moving or anything like that that people normally would attribute to a stroke?
No, I only had trouble speaking. And so she recognized that my inability to speak, and the kids told them my mom can't speak, and I think she asked them some questions, and they said, when she tries to speak, what does she sound like? And they're like, it doesn't sound like words. So she recognized that it's a stroke. And that's what she thought right away. I haven't talked to her to see why she thought that, but I'll have to ask her. But so Jody, she called Jody. Jody got to my house. She has access to my house. As a single mom, there's certain people that have full access there. You have keys to get into my house. And she came in, she was there within like 2 minutes.
Good. We all have those people we trust a lot to help us out when we need it.
Yes.
So that's a good learning point for the listeners too, right?
Oh, yes. Always have somebody who you trust that can be there for you when, because had this happened and I did have some kind of disability and couldn't walk, like there's some people who have strokes and they completely lose their ability to walk on one side, or they lose one whole side of their body. And so luckily that wasn't the case, but she got here, and then she was like, we're going to the emergency room. And I was very confused, and I was like, no, I no, because I felt fine. So I don't need like, so this is, I think, is where my brain is just not, is obviously not working properly, because a somebody whose brain is working properly would go, yes, I need to go to the hospital. Something's wrong. Um, and so like we couldn't find my keys, and she kept saying like, where is it, where is it? And I said, I told her, she's like, where's your purse, where's this? And I kept saying room. Well, she thought I was saying room, but what I was saying was room. So I had to make like, I was like, she's like, in your car. I was trying to say vroom vroom, like, because I could not get anything out. And at this point, I was trying to say words. And that's when I started to get scared, because I was really trying to say the word. And so then I just started crying, because that's all I could do was cry. And we went to the emergency room, and this is during COVID. And so Jody told them, I think she's having a stroke, and they just like walked me right in. And then she was with me, and she asked, like, she's like, can I come with her? She can't speak. And they were like, yes, yes. And so thank God they allowed her to be there with me. She did all the paperwork.
Well, that's pretty amazing, actually. So I'm glad they went against policy and allowed you to have a friend there. I know a lot of the hospitals weren't allowing friends into rooms at that time. Now, I didn't know about the COVID component. Was your stroke part of COVID or not COVID?
So it was not COVID related. That's what everybody thought. That's the first thought, because it was actually, my stroke happened like right after the report started coming out that COVID can cause a stroke, or like some people with COVID. And so that was their immediate, I think everybody's immediate thought. So the ER I went to was a satellite ER, and there was nobody there at all. I was the only patient at the time. And I think that kind of also is why they allowed her in. And I could not speak. Like, they weren't going to get anything out of me. So luckily she knows my address. We work for the same company. So she knows my insurance. She knows all the information that was needed that they needed. So, I mean, that, and thank God I was not alone. Because at this point I couldn't stop crying. And that also is, sometimes your brain does that with brain injuries. And I didn't know that, but for the first day or two, I just cried unconditionally. I just cried a lot. And I couldn't stop it. I couldn't make it stop, or I had no control of it. But they did all the tests, and then I do remember I was able to say curse words very, very clearly, because I got very, very pissed.
Do you think curse words are in a separate part of your brain than where you had your stroke?
I don't know. I've never really looked into that, but I got very angry because they told me I was going to the ICU and an ambulance was coming, and I wanted to go to work because I had a very important meeting the next day. And I was like, no.
So I had a lot of irrational thoughts too when I had my traumatic brain injury. Like it just wasn't working right. Like looking back, I wrote a paper. I'm never going to publish that paper. It is terrible. It was very third grade level, and I thought it was the greatest thing at the time. And looking back, it was not.
Yeah, I was really like I was not in my right mind at all. But when I would get upset and I could say curse words, like my friend Jody was like, yes, keep doing that. Get angry. Like, and she was making me laugh. I think at one time I told her, I was able to say, I think I told her, I said, not a little bitch. Cause I was trying to say like, I'm not like, that's all I could say.
That is hilarious.
Yes. And I think I was trying to tell her like, I don't cry like this. I'm not a little bitch. And she thought it was funny. And then it just pissed me off even more.
So being a guy, there's like two emotions. Everything's okay, and I'm pissed. Like those are that's as deep as we get most of the time. Yeah, I was pissed for a while too.
Yeah. Yeah. And I was pretty mad. And then right then the ambulance came, and that's the last time I saw anybody that I knew. And then and that's when I got really scared. I just got really scared because now I'm not with anybody that I know and I can't communicate. And I didn't know what was going to happen. So that was pretty scary. Um, and then I got to the ICU. It was pretty late. So they did a CT scan at the satellite ER, but it was pretty late. So they didn't do anything that night except for just get me settled. And then I was hungry. So, but I couldn't tell them that I was hungry. Um, and so like I was like just pointing to my stomach, and they were like, your stomach hurt. And then I was just like, no, like, they're like, are you hungry? So I could not. And I was just terrified at that point. And the ICU nurses were really amazing and very, very kind.
So from personal experience, the ICU nurses, pretty much anywhere you go, are pretty amazing. So a shout out to all the ICU nurses.
Oh yeah, they were amazing the entire time. Even so like the next day was when I started to get all these tests. And they did something with my heart, but not the scary one. But
So I bet it was an echocardiogram, right? Like the
yes,
ultrasound of
that's
your
the one.
heart.
Yes. Yeah.
Yeah. So those are really helpful, especially if, say, you had atrial fibrillation and you built a clot. If it came from that site, or if you had what we call vegetation, that's probably what they were looking for.
Yeah. So yeah, I do remember they did that, and then they did an MRI. And then that one they asked me if I was claustrophobic, and I was terrified. And because all I could say was yes. And so next I remember getting into the machine, and then I remember them wheeling me up to my room, and then I was out of it.
So I don't know about you, but when I got my ding to the head, time seemed weird. How long do you think you were in the MRI machine?
It felt like half a day, and it probably was like maybe 45 minutes, if that.
I can tell you that my patients always think it's about a half a day when I send them to the MRI, but yeah, they're pretty
Yeah.
quick. So definitely some interesting things for you. Interesting time distortion.
Yeah, I had no idea about time. Apparently some people called me, and at this point I was starting to I could say like certain words, but and this is after the MRI. And so I found out I'm trying to remember the drug that they use, but it's the one that like keeps killing people because they take too much, or it's like laced and that's like it's an opioid that they use. Fentanyl.
Oh, yeah,
Yeah.
fentanyl's a hell of a drug.
Yes.
I specifically, when I got another injury, when I rolled over that buggy and broke my arm, that was the only one that helped with the compartment syndrome pain. But I also know that I can never have that again.
Yeah. Yeah. Fentanyl that's what they gave me as a sedative. And so I didn't know this till later after I saw my medical records. So that's why I was out of it. And then I guess I talked to people, and I guess I scared them because I sounded my speech sounded like, my brother explained it, like the way my brother said it was, I sounded like 4-year-old Courtney. So I sounded myself and I was like 4 years old. My speech was very broken, very, very simple sentences, very, and then the one thing they did always keep giving me was they gave me this, I guess it's the the stroke worksheet, and it has like that's like the what's wrong with this, and like I had to like say what these were.
Oh, that's a beautiful little document. We'll have to put those in the show notes because yeah,
Yeah,
some people can't identify that, water overflowing and kids standing on the chair like
yeah.
that.
I told her,
Processing's not
I think I told them that I said that's a bad mom.
not like the video Bad Mom.
No, not like the video, but I was like, wow. That's all I could think of was like, she's not even paying attention to her kids and the water's hitting the floor. Like, she's a bad mom. And the nurses laughed.
Yeah, I mean, sometimes it's the only thing that keeps you from crying when it's like that.
Yeah.
Now, I didn't realize that your stroke happened within the last year and a half. When exactly was your stroke?
My stroke happened August 17th, 2020.
So we're not even a year into this.
No.
I have to
Yeah.
I have to say you've recovered quite well. So
Yeah. Yes. When I first saw the neurologist, finally saw the neurologist, which was the first day, but it felt like forever. Because the nurses, I was getting neuro checks from the nurses constantly. Even I saw the cardiologist before I saw the neurologist, and my cardiologist gave me a neuro check because everybody was just so fascinated that I didn't have any left or right side weakness, and it was just my speech. Like, everybody was very fascinated by this, and they were kind of couldn't believe it.
I mean, I've had patients that have had such small strokes that they only lost a piece of their vision, and they were having similar issues where they weren't making the same connections that they would normally make, but for them, their stroke was very specific to that one corner. And
Yeah.
it's pretty amazing when you as a physician find those things because you're like, "Oh, I'm really happy I did a physical exam."
Right. Yeah, they were also very happy that I didn't have any, obviously, because a stroke is very devastating most of the time. And he explained it. He showed me, remember, it was across the room, but he put my brain up and he was showing me all the normal places. And then he said, do you see this where it's black? And, it was this giant black spot. And he was like, you lost your entire, and he just said, you lost this entire part of your brain. He said, that's dead and it will never grow back.
So, did they happen to tell you what part, like Broca's area, or?
He didn't tell me what part. He just told me it's where my communication and language was. So he didn't say like which exact area.
Wow, that's scary.
Yeah.
Like a big portion. But look at you, less than a year later, and we're having a very good conversation. So, how long did it take you to get to this level of communication again?
It took me, I'd say, about 30 days to be able to speak to people who really didn't converse with me often could not tell. It was about 30 days. My neurologist told me he didn't know if I would ever speak again. And he said, looking at your brain scan, I would say no, but the brain is an amazing thing and you never know. That's what he told me. He said, but looking at your scan, you may never speak again.
Yeah, with that type of an injury, yeah, that would I'd be surprised for it to come back too.
Yeah.
So obviously, even neurologists, some of the smartest people in medicine, don't know everything. So we're always learning, and that's
Yeah. Oh, I am so thankful of our brain's ability to not really heal itself, but to find new connections. Because I know that part of my brain will always be dead. I just have now, I have a different part of my brain that has taken over that workload, I guess is the best way. That's the best way he described it to me. He was surprised because so like these are the words that are in there. And so I could not say huckleberry to save my life or baseball player. And I could not say any of the sentences. I could read them, but I could not get them to come out. Um, and that was by the second day.
so I have a question on that. Was that strictly the reading of those? If he like read it to you, could you repeat it back?
No, I could not. And I knew that, like, I could read when I read the words, that part of my brain, the reading part of my brain, I could read the words. I couldn't, I couldn't make the sounds come out. And it was like the words were always on the tip of my tongue. So they told me I had aphasia. That's what they told me. They said, you have aphasia. And so I could say mama, I could say mama right away. I could say tip top right away. 50-50, I would say it twice because when I looked at it and it says 50-50, I felt like I had not said the second part. And then I could say thanks.
So I wonder if there's any component of that where it's like the mama is like one of the first words we learn, right?
Right.
So I wonder if that was like deep ingrained kind of a word for you. And then tip top, I mean, that's very
Right.
army-ish.
Yeah. Yeah. And I mean, it was really weird and how I I haven't actually looked into it, but I wonder how they came up with these words to put them on this list. Like I feel like there's a reason, and there's a reason why they go down in order. And I couldn't say I would tell people, I would try to tell people I had a stroke. I couldn't say the word stroke. And so I would have to like sound it out and it still came out wrong.
So would it have been easier for you to say cerebral vascular attack or accident? That's kind of what the other name for it is, or CVA.
Probably not, because I also could not say ICU. I would say that I was when I would finally they would have family members call me because remember COVID, nobody was there. And I would say like UCI. I could acronyms. I was having the hardest time with acronyms, which I work for the Army. It's not good. like, but I couldn't say ICU.
That's what we call it, Charlie Foxtrot.
Right. Yes. Yes. That's exactly what my brain felt like. And so I had this amazing speech therapist who she saw that I had this one piece of paper and I was working on this piece of paper nonstop. And so you get therapy in the hospital after a stroke. So the speech therapist came and she brought me this whole, like, this is a binder. So this is all the different like things that you can do. It's the strategies to use. So the one that worked the best for me was to describe it. And then to write it out. Like I try to write it out, even though I didn't do it well. But describing it really worked well. And then this is it just has a bunch of, she basically copied, well, I use this for the first 2 weeks, anytime I tried to make a call, because I didn't know how to make a phone call. I couldn't work a phone.
So, and you have some writing that examples that you wanted to share as well, correct?
Yeah. Yes. I'm looking for the ones that don't have, because I was working on numbers too. And that was, so there was here, it has some of like my coworkers' names. And so I could say like Dave, Vern, and then like one of the wives is Kathy, and I couldn't, if you know, it's like, it's not quite a very good. And then like that, I was writing Susan. Like that's not Susan.
So for the listeners, I'll describe that as Kathy was you started doubling up on the TH uh, component, so it's almost like Kathy.
Yeah.
And then Susan, did you put an alpha in there?
Yeah, it's Suasa. It's not like that's, yeah. And then I wrote my kids' names without any problem. So it's Brendan, Liam, and Ainsley. So I could say their name, write their names. I have no idea who I was trying to write there. No idea.
Yeah, it's almost as if you have a J and then an E and A at the same time, and then another A and SS. So it's like, are you trying to say Jess or?
Yeah. Like this is not my handwriting. This is actually the speech therapist. She was writing it out as I was trying to write it. And because I was trying to do, we were doing exercises where I was trying to describe. So she was like, it was things that begin with the letter C, and then like someplace that you eat, and it was cafe. And I was having a hard time getting that out, or a canister I couldn't get out. And that scared me. Like this one, I think it was just, I was trying to write destroy. She fixed it, but it's not good. It's, yeah. And then
So you have come a long way. So what is your writing like now?
so now my writing is, so this is like this right here was when I was in the speech therapy in Mentis. So I went to Mentis, which is a rehab, a neurological rehab place. And so now, and that, which is pretty much my handwriting now. And so I didn't have, I write very clearly, and like, this is when I was, I asked somebody to write down stroke for me so I could practice it, because I could not write stroke. I was trying to write down, that's supposed to say gateway for like my mortgage company. I was trying to write down where I had to, like, what bills I had to pay.
So your penmanship has actually changed quite a bit too during rehab. So it seems like you've done a lot of work. What things are still, difficult for you?
So yes, I have done a lot of work. Like I mentioned, I went to a rehab place, which was really hard because I couldn't see my kids at all. The biggest thing that, the things that are still hard with me is that I feel like I'm 100%, but it's little things that I used to be able to do before with like my programming and my logic. I used to just be able to do things very easily, and sometimes I struggle in that, and I get very frustrated. I'm very hard on myself. I work for an amazing company that has allowed me to heal on my own time without making me feel less than. Like they don't push me too much, but they want to make sure that I'm okay, and I don't push myself too hard. And so they think I'm too hard on myself.
So we all wish we had companies like that. I know after my accident, one of the administrators told me that they would stop paying me my salary if I didn't come back after 2 weeks. And At that time, we were pretty sure I had a TBI, but um, and I know my boss figured it out pretty quick, but yeah, the administrator side of my work did not
Yeah, and
have
that's
any give.
unfortunately, from what I've learned, that's actually the more common thing that happens. Because when I was in the rehab place, there one of the things they have to do is assess how much time do I have there? How quickly do I need to go back to work? Are they going to have to fight for me? Or and so like the first day that I was there, I got there on a Friday. So it was really the Monday after um they wanted to call my boss. So I was like, oh, okay. I went and I was like, I just called him and picked it up, and he picked up right away and he was like, hey, Courtney, how you doing? And I was like, oh, I'm here with the people in Mentis. They just want to see like what you where you expect me for my timeline for going back. And you and he said, she'll come back when she's ready. There's no hurry. Um, she doesn't have to worry about vacation. We'll make sure that she has vacation. And so I found out that all of my coworkers donated leave for me. And then if he had told me if anything happened, like where we needed more after that, he said the company would just pay it, which that's unheard of. I mean, completely unheard of.
So that's amazing. I'm so happy you are blessed with good and understanding coworkers and employers. How would you, if you had to talk to anybody that had strokes, what advice would you give them?
I would give them the number one advice I would say is don't ever give up. Don't ever, only you know how much you can work, and only you like just because they say something might happen doesn't mean that it's impossible. And I read this one book called My Stroke of Insight, which is she is a neuroscientist who had a stroke, which is insane, like crazy. And it took her 8 years. And so while my recovery is not usual, mine's not. I don't know why. My neurologist actually thinks that I may be ambidextrous and that I already had connections on the other side of my brain, and that's why I recovered so fast. Like he's pretty convinced that that's because there's no like most people do not recover on as quickly as I have. My but so I would say that they just don't give up, work hard, but also give yourself time to rest because your brain needs to heal. And sometimes you need to sleep. So like make use of your time when you're awake and get good, really good rest. And so that might mean for somebody like they're working on trying to just move that arm, and that work for an hour may be it's so hard. It is so hard. And I understand that. Like it seems like, oh, that's such a small little thing. It is not little to a stroke patient. And so just like keep winning. Like my friend Jody used to tell me every day, she said, just win every day. Just find one thing in your day that you won at. And it could be the smallest thing, but take every little victory and just win every single day. Because and it's a uphill battle, but it's worth it.
And that, what you just said there, take a win every day. Everything can be like that, right? Like that's actually life lessons that you got there.
Oh, yeah. And it like the stroke completely changed how I view life in general. And also how, in a way, I feel like it made me a little bit more empathetic, or because you don't know what battles people are fighting. And like, I felt like people thought I was stupid because I couldn't speak. And I'm a very highly intelligent person. And all I wanted people to know was that I'm smart. And just because somebody can't speak does not make them dumb. Like, it's in there. It is there. So like, don't treat a stroke patient as like they're dumb. Speak to them just like you would have before the stroke.
And that's actually a good point too, because there's different ways of measuring IQ, but if you judge everybody the same way, you're not going to capture the intelligence other ways. Like,
Yeah, and it's just so many people, even people that knew me, like would kind of talk down to me, and I hated it. Like, it pissed me off. And so but I really appreciated the people who spoke to me the same way as they have always spoken to me. And that I just really appreciated that, where I appreciate that they also allowed my mistakes. I still have problems with words. I made a couple mistakes today, I'm sure. Most people don't notice. I hear every mistake. We're harder on ourselves.
I completely understand that. I know I judge myself pretty harshly, but I can tell you also, you're allowed to make a few mistakes and it's okay. Honestly, thank you for sharing your story and perspectives. Man, honestly, congratulations on your upcoming doctorate.
Oh, thank you. Thank you. I'm excited and a little nervous, but I honestly did it to help my brain heal, because I figured what better way than learning again.
I'm so inspired by your story and proud of your recovery. I hope that we can talk again soon.
Yes, I look forward to it.
In regards to brain injury, we know that our brains are very powerful. We know that when they're injured, we feel helpless. I am so proud that we have the ability to recover, and I love that we can learn to improve despite our injury. Views expressed here are our own and do not reflect the views of any past or present employers. This is intellectual property of Dr. Busey, Revolutionary Healthcare PLLC. Thank you for listening today. I hope you enjoyed the podcast. I hope you were able to laugh, empathize, and consider different perspectives. Feel free to join the conversation in the comments. Subscribe if you like the podcast. From Doc Talk, we hope you have a productive and healthy day.